Hello, welcome back or welcome to another video of mine. My name is Marian. In today's video, we are going to talk about the ARRT Standards of Ethics and the ARRT Codes of Ethics. I do have my certification through ARRT for like multiple modalities, so we are just going to dive into their codes of ethics because it will be asked or you will have to know it for your exam if you are studying for your registry. And if you do not mind, could you all just please leave a comment under the video? Just let me know if you are watching because you are an X-ray student studying for your registry boards, or if you are another radiology student for CT, MRI, IR, ultrasound, nuclear medicine, mammography, or if you are already a technologist, you're already registered through ART and you are just watching this video just to brush up on what is the code of ethics. So just let me know in the comment box and thank you all so much. Okay, so now we are going to get into the ethics requirements. All of this information can be found on the ART website. I know some people they like to listen to the information. Some people like to read the information. So this is all from the ART website. So you would just go to the ART website and this information will be found under ethics requirements. And then what I did was I clicked on the ART Standards of Ethics blue link right there under the ART Standards of Ethics. So that's where I clicked on to get to the information I'm about to show you. So the ART Standards of Ethics. So who is it for? Why do we have it? What is it for? So it's pretty much for all individuals that is certified and registered by the ART, as well as those students who are applying for certification and registration. These standards serve as a guide for maintaining high ethical standards and ensuring the protection, safety, and comfort of patients. So, pretty much, it's going to prevent you and discourage you from practicing in an unethical way and manner. Making sure that you know that you are held to a higher standard of protecting the patients, protecting other staff members, protecting the comfort of the patients instead of getting your license and disregarding the patient's feelings and the way you should do things in the appropriate manner, pretty much. The ART Code of Ethics. This is a crucial document for maintaining your professional standards in the field of radiology and also maintaining your professional license. So we'll get into that later on in the video because if you do not follow these rules and the code of ethics, your license will either be suspended or taken away. So just make sure that you know all of this information for your test, of course, but also whenever you are working as a tech, because a lot of people license have been removed or even suspended. So these codes are important to ensure the appropriate and correct ethical behavior in all of the patient care aspects and professional conduct that you are doing. So with your ART rules of ethics, this is going to cover unethical conduct or behavior, fraudulent activities with ART registration and license, being convicted of a crime, sharing questions from the ART registry exam. So this is also called subversion of ART exams, sexual misconduct, performing radiology procedures without the proper license or certification, compromising a patient's health or patient care by participating or performing in an unprofessional conduct, falsifying patients' medical records, failure to report any rules of ethics violations. So when it comes to falsifying patients' medical records, an example of this would be, say for instance, if a patient told you something and it was going to delay their exam because you needed to check and make sure it was safe to proceed with their radiology exam. and you told them you had to reach out to your manager or reach out to the radiologist to make sure that they can get the scan done, especially if it's for MRI, and the patient is like, oh, no, 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 I changed my mind. I don't have this, or this was years ago. I said the wrong thing. You can't you can't falsify the records. So falsifying the records is acting like it never happened, it was never said. So one thing that you can do is whenever you have to um, get rid of something on a paper, because you know in medical we all write in pen, you supposed to, or you have to write like one line, draw a line, one line through the information if it's incorrect. Because sometimes patients chart, they check yes and it should be no, or they check no and it should be yes. So you can just draw a line, check or write what they meant, and then date it and get them to initial. That's different. But if they told you something and they know that it's going to delay their exam from starting, so they want you to act like you never heard it, you cannot do that. That's falsifying the patient's records. And then there's other examples of falsifying the records, putting things in there that's not true, that wasn't done, that wasn't said. So those are other examples of falsifying the patient's records. Okay, so like I was saying, all of this can be found on the ARRT Standards of Ethics, but I have an X-ray registry review lesson going on, and I did have a member to my my channel wanted me to cover this, and it is on the exam content specifications for your registry. So pretty much these ethics are in place for anyone who works in radiology, whether you're radiology, nuclear medicine, radiation therapy, CT, MRI, anyone who has their certification through ARRT. This is information that is given to us for us to follow, because we have ethics that we have to uphold, that we say what we are going to do for patients, what we're not going to do for patients if it's something bad and can injure them, or so these are just the standards of ethics that we have to follow, that we must follow, or our license will be taken away. And as you can see, this information is, if you look at the bottom, on the bottom, it's like from September of 2023. So they do update this a lot, but what I'm reading is from 2023, just in case something comes out for 2024 or 2026. This information is from 2023. So the codes of ethics, this is going to be for any radiologic technologist or any registered technologist through ARRT. We supposed to and is going to act in a professional manner whenever we are caring for a patient, whenever we are at work, even whenever we are not at work, whenever we are working as a team, working with other coworkers. We have a professional mannerism that we must maintain. We cannot um, we cannot use a patient's race, their sex, whether it's female or male, who they are married to, who they aren't married to, their sexual orientation, disability, age. We cannot use them against them in order to not perform the duties that we have to perform. If someone has a disease or illness, we still supposed to take care of the patient. We cannot say, okay, this patient has, let's say this patient has TB, or this patient has COVID or hepatitis. I'm not doing their x-ray because I don't want to get sick. You cannot do that. You have to still take care of all patients, regardless of who they are or what condition they have. Even if you know they are bedbound and they cannot move the correct way, you know that if you get them in the MRI or CT scanner, they will not hold still. You still have to do the exam and just put notes in. So this falls under the code of ethics. We're still doing what we're supposed to do regardless of who the patient is and their condition. So with this information, the registered tech is going to act as an agent through observation and communication to obtain pertinent information for the physician. So we are still going to get the proper medical history, the proper diagnosis, ask the proper questions, look at their medical form that they filled out whenever they are signing in order to aid in the proper diagnosis and treatment for the patient so that the radiologist can know. So if a CT head was ordered, instead of putting AMS like you see on the patient's chart, find out why the CT head was ordered. AMS stand for altered mental status. Instead of just putting AMS, put, what did the patient tell you? Did the patient tell you that they failed? Did the patient tell you that they've had headaches for 5 months? If a patient come in for a chest X-ray, don't just put SOB for shortness of breath. Put shortness of breath for 5 days, chest pain, coughing for 2 weeks. You have to put more information, regardless if the patient was late or if the patient was seen late because of a delay on the tech side. If they have a pleasant attitude or not, you supposed to greet the patient with a smile, say who you are while you're doing their exam. You have to have a professional manner whenever you are, you know, dealing with patients in a patient care aspect. So we are going to use our equipment and accessories, employ techniques and procedure, perform services in accordance with an accepted standard of practice, and demonstrate expertise in minimizing radiation exposure to the patient, ourselves, and other members of the healthcare team. So even though you have your license or you're trying to get your license, you cannot take a chest x-ray at, let's say, 200 kVp and 150 MA, mass. That's not the appropriate kVp and mass setting technique. So take the images at the appropriate exposure factors level. You also have your registered technologist is going to practice ethical conduct appropriate to the profession that they are working in. So the technologist is going to improve their knowledge and skills. We have to participate in CEUs, our continuing education, any professional activities. There are different organizations that has like meetings that they do every year or quarterly, or they have like certain um, webinars that you can participate in just to be familiarized with new changes because healthcare and technology and radiology changes all the time. So I know I graduated from X-ray school in 2014. So from 2012 to 2014, it was drilled in my head to use lead apron shields or any type of shield, thyroid shields, shields for patients. But now it's like discouraged to use it. So I'm not really discouraged to use it, but now they want you to use it wisely. If a patient is pregnant, so it's just a lot of things have been changing with technology. So you have to like stay informed. Also, you have to refrain from the use of illegal drugs or any legal any legally controlled substances. So you want to just make sure that you are working with a clear head. You're not taking any illegal drugs. If you have a headache, you can take headache medicine, whatever you use for your headache, you can take that. But do not come to work with, drugs in your system under the alcohol influence, or even if you know that Benadryl is going to make you drowsy, do not take Benadryl at work. Okay, now for our rules of ethics. This is the second part of the standard of ethics. These are mandatory standards of minimally acceptable professional conduct for registered technologists and candidates. So with this information, ARRT certification and registration demonstrates the medical community and the public that an individual is qualified to practice within the profession. So the rules of ethics are enforceable. registered technologists are required to notify ARRT of any ethics violations, including state licensing issues and criminal charges and convictions within 30 days. So let me highlight that for you. Within 30 days of the occurrence or during their annual renewal of certification and registration, whichever comes first. So make sure that you are reporting this within 30 days of when it occurred. So with this information, we have fraud or deceptive practices. So do not commit any fraud, whether it is saying that you signed up for your license and it was renewed and it really wasn't. You're turning in this information to a job. I'm saying, hey, I have my ARRT license, or my ARRT license is coming in a week, when you know you haven't taken your test. This is like if you're trying to get a job and you go for an interview and they ask, hey, when are you getting your x-ray license, or when are you getting your MRI CT license, and you tell them you're getting it in 5 days or a week, and you know you haven't taken your test at all, but you're saying that just to get the job, then that's fraud. And then you want to make sure that you are not engaging in false, fraudulent, or deceptive or misleading communications to any person regarding any individual education, training, credentials, experience, or qualifications. So do not tell anyone you have 15 years of experience to get a job or to get more money at a job whenever you only have 6 months. Or do not put that you do 8 modalities or 6 modalities when you only are licensed in one. So fraudulent billing practices, knowingly engaging or assisting any person to engage in or otherwise participating in abusive or fraudulent billing practices, including violations of federal Medicare and Medicaid laws or state medical assistance laws. So do not um, pretty much falsify or hike up MRI prices, MRI scan prices, just because you know Medicare is paying for it. So that's committing fraud. Now for the subversion, um, pretty much in a nutshell for this one, do not repeat what is on the ARRT exam. Do not share with anyone what is on the exam. Do not tell them what questions will be asked. Do not tell them, do not give them any material. Do not copy any material from the ARRT registry. Do not um, copy, publish, or rewrite what was asked on the exam, because this will make your license get taken away. Because when we are taking these registries, we're taking them as we know the information that's on there. So the ARRT, they have a content specification where they let radiology techs and other techs know what's going to be on the exam, how many questions is going to be covered. So that's all on their website, public information. However, you cannot say, okay, they asked this, so make sure you know this, because they're going to ask you this question and it's going to be worded like that. You cannot, repeat that to anyone who is going to take the test, or anyone in general. You cannot repeat what was on your test, what was on your structure self-assessment, your SSA, for your CQR that you have to take every 10 years. You can let someone know, hey, I did bad on it. I did not study. I should have studied. I have to take um, my test over. I have to um, take 7 CEUs extra because I did not score high on my CQR. So if you don't know what CQR is, I have a video about that, but I can make a new one. Just let me know and I can go over that information. So pretty much CQR is not a new registry. It's an assessment that has to be taken every 10 years after you get your license. People who have gotten it before a certain date and a certain year do not have to take it, but I have to take it for all 5 modalities that I have. I've already taken it for X-ray. I have to take it for CT now. So it's pretty much, it's not pass or fail. It's going to test your knowledge. However, if you do not score well on it, you will be assigned more CEUs depending on how good or how bad you scored on it. Now for the subversion continued. Do not provide false or inaccurate, altered, or deceptive information related to your CE, clinical experience, or competency requirements. So this information is saying whenever you are in clinic, say you're performing your clinical exams right now, and on your sheet of paper that your teacher gave you or that you got from the ARRT website to document your clinical training, do not falsify that you was there in clinic for 12 hours when you know you was there for 8 hours. Do not falsify that you did a chest x-ray or a KUB or CT head MRI brain when you know that you didn't do it. And then whenever you are performing your exams, do not falsify that you did an exam on this patient at this time and this date when you didn't, and it was done when you wasn't there. Or do not put an incorrect MRN number on your paper stating that, okay, I did this exam on this patient. So when I was getting my comps for x-ray, MRI, anything that I went to school for, when I was getting my comps, I made sure to write the date, the exam, the MRN number for the patient, and who was signing off on it. Because some people, they just put whatever exam they did and the date and the time, but what if that information get deleted off the scanner? Then you don't have that information. So always put the MRN or the accession number to the patient that you are taking those X-rays on or doing those scans on. And then this information is just saying, do not make any false statement or knowingly provide false information to ARRT. Failing to cooperate with any investigation by ARRT in full or in part is against the ethics that they want us to uphold. Unprofessional conduct. So this is engaging in unprofessional conduct, including but are not limited to a departure from or failure to conform to applicable federal, state, or local government rules. Um, any x-ray tech that may practice or create unnecessary danger to a patient's life, health, or safety. So do not restrain a patient against their will to get a chest x-ray or to do an MRI scan because your list is piling up and you're trying to get them cleared off your list pretty much. So if you know a patient is claustrophobic in MRI, do not just hold them down while another tech is scanning just so they don't have to come back down. Do not perform in any sexual misconduct with the patient, with the coworker, with anyone outside of work. Do not participate in unethical conduct where you are deceiving, defrauding, committing harm to the public at work, not at work. Anything that can jeopardize a patient's safety or someone else's safety, do not participate in it. Make sure that you are performing in your scope of practice. I work in 5 different radiology modalities. I have my certification through ARRT for X-ray, CT, MRI, mammography, and breast ultrasound. So this is saying you want to perform in the modality that you are licensed in and trained in, because and then the picture at the bottom is the bone density machine. And the picture that I'm posing in front of, that's the mammogram machine. But if you are participating in modalities that you do not have a license in and do not know how to operate the machine, then the patient's images is not going to come out correctly because you're not making sure that you have the correct anatomy or the correct setting or the correct positioning for the patient. Improper supervision in practice. So you are knowingly assisting, advising, or allowing a person without a current and appropriate state permit, license, registration, or ARRT certification and registration to engage in X-rays, MRIs, CTs. So if you are an X-ray tech, this is an example, one example. If you are an X-ray tech and you have to hold down a patient or hold a cassette for like a trauma knee or a trauma hip. You cannot get a family member, a transporter, a nurse, anyone who is not registered in X-ray through ARRT, you cannot get them to take the X-ray for you while you put on that lead apron and hold a patient or hold a cassette. That is improper supervision in practice. Improper delegation or acceptance of a function is delegating or accepting the delegation of a radiologic technology function or any other prescribed healthcare function when the delegation or acceptance could reasonably be expected to create unnecessary danger to a patient's life, health, or safety. Actual injury to a patient need not to be established under this clause. Okay, so fitness to practice, actual or potential inability to practice. So this actual or potential inability to practice radiologic technology with reasonable skill and safety to patients by reason of illness, use of alcohol, drugs, chemicals, or any other material that is preventing you from mentally or physically taking care of a patient. So like I was saying in a few slides ago, do not be, under the influence of drugs or alcohol or even Benadryl and cannot perform your duties properly. Improper management of patient records, falsifying that you try to take images on a patient and they wouldn't hold still, but let's say they came in with a bad attitude and you just didn't want to do their imaging, then that's falsifying because that didn't happen. You just didn't want to do it because the patient or or the nurse or the transporter, someone got an attitude, so now you're taking it out on the patient. So you cannot do that. You cannot say something was done and it wasn't done, or you cannot say something wasn't done and you know it was done. For your criminal proceedings, you want to make sure that you are reporting it correctly to the ART of any convictions, criminal proceedings, or military courts martial as described, like a felony, a gross misdemeanor, or misdemeanor. Whenever you are signing up for your license or to renew your license, it asks you if you've ever been convicted of a crime, if you have any criminal charges or any misdemeanors or any felonies that have occurred since you renewed the last time. So make sure that you are being truthful and just select what is the correct thing to select. Also, register as a sex offender. You want to make sure that you put this information. You must report everything that is considered a violation. So failure to report any violation is knowing of a violation or a probable violation of any rules of ethics and you fail to report it. So make sure that you are reporting everything that you know is a violation. Failure to immediately report this concerning an error made in connection with imaging, treating, or caring for a patient. Those would be some examples. Now, for the administrative procedures, this information is pretty much going to just tell you that there are like ethics committees and the chair of the committees that will review any type of violations that has occurred with anyone who is registered through ART. So this is what this information is saying. You can pause the video and read it, or you can go to ART website and read it. But it's pretty much saying that there is a committee, and you have the president who is over the board of trustees, who is going to review like different cases that comes in when it comes to violations or misconduct or unethical situations. And then you will also have like a preliminary screening of the potential violations of the rule of ethics where you will have to speak about what was violated. They'll go through what was violated, what was alleged, what was found, and then you will have to go through like a hearing with different staff members of the ART board. And then this is the hearing that I was telling you about. Let me highlight this information. A registered technologist or candidate may waive the 30-day time frame to request a hearing. So whenever they do have you go for a hearing or request a hearing, just make sure that you are, checking your emails, checking your mail, because if you do not respond within the 30-day notice, then for a fact your license going to be taken away or suspended. So you need to go in and do it virtually or go to the location that they want you to go to so that you can defend your case. If something was said and it wasn't true, you can defend yourself, but you have to make sure that you are responding in an appropriate manner. So this is what this information is saying. You can pause it and you can read it and make sure that you are familiar with this information. And then this is just going to talk more information about the hearing that I just mentioned. Okay, if you want to appeal, a written request for an appeal within 30 days must be mailed to the committee, and I will highlight this information right here. A registered technologist or candidate may waive the 30-day time frame to request an appeal. So just make sure that you know this information, because if you go past the deadline, then you do not pretty much have a defense if something was alleged that you did and it wasn't true. So just make sure that you are checking those emails, those spams, and your mail. And then just pretty much going over the range of actions that is going to be taken, whether it's no action, which is a determination of no action means that there is little or no evidence where the violation even occurred. So that's why it's important to follow up on your appeals, and if something was alleged or reported against you, that you are knowing what to do, because maybe no action will be taken, or if something was done, maybe your license just going to be suspended for a month or 3 months, versus if you do not follow up on this, it could be taken away altogether. Suspensions is the temporary removal of an individual's certificate and registration, and it can occur for categories for up to 1 year. So let me highlight that. This is right at the top. So do not participate or do anything where you know your license is going to get suspended. I always say you went to school, let's say for x-ray, from anywhere from 2 to 4 years, and then you went back for other modalities. Don't do anything where your license can get suspended or taken away. Always reach out to your supervisor, manager, radiologist if you don't understand anything, or if you have to take an exam and you're not sure how to take it. Reach out to your manager if you need more training, because you do not want to get your license taken away or suspended. And then when you apply for these jobs, I believe on the application it asks if your license has been suspended or revoked. So that's one thing that you don't want to check, because I mean, check it if it happened, but I'm just saying, worst case scenario, you don't want to have to be the one to select those, because now the company is going to want to know, why was the license suspended? What did they do? Are they being truthful on their application? If they find out that it was suspended and you didn't notify them or you didn't put it on your application, so the company loses trust in you. So just make sure that you report everything truthfully. Then there are different things where your license or your certification can become ineligible for renewal. Your license or certification can become revoked. So just make sure that you are doing what you should be doing so that your license do not fall under this category. And then there are different procedures you have to follow if you want to get something removed off of your certifications or your license. Contact ARRT. You can also call them. There are different prompts that you can follow to know how to remove these requests or violations if they are able to, especially if it didn't happen. And ARRT They do have a list of revoked and suspended licenses that can be found on their website, of individuals that had to have their license either removed or revoked or suspended. I have the link posted right here, and this is how that page will look. So it does give the name, the ARRT ID, their birthday, city, state, the date. It gives all that information. As you can see, there are a lot of names on here. I think this is saying 2100 names, over 2100 names on here. I did see the names when I went on the website, but out of their privacy and respect, I did not want to share it on my page, but it is on ART website. Even for nursing, they put whose license was taken away, suspended, or revoked on their website as well. But just out of respect, just since I'm reporting this information, I just didn't want to put those individuals' names out there. All right, so that's it for this video. If you found it to be helpful for you, please give the video a thumbs up. Leave any comments that you may have. And I always say just safety is better than speed. So I always practice safety over speed, because you do not want to speed and hurry up to get a patient done, and then now you're jeopardizing their safety, or you're scanning the wrong patient, or you're giving contracts that shouldn't be given, because that's another way that your license can be taken away. So this can be used for your X-ray registry review, CT, MRI, any radiology registry that you are studying for, because this information will be asked. And then also, if you violate this information, your license will be taken away. So I hope you all enjoyed this video. If you did, please give it a thumbs up, and thank you all for watching. Bye.